Good morning, practical nursing students. My name is Darlene Lepresto and I'm a nursing instructor here at Jackson College. And today I'm going to show you how to take vital signs. And we're going to talk about the different equipment that you use when we perform vital signs on our client. So we have our client here. I'm going to go ahead and just first wash my hands. And then I'll explain to you some of the equipment that we have here. So of course we need our stethoscopes, and then you were given those in your packets. And before you start with your patient, you want to take an alcohol swab and clean the ear tips and the diaphragm of the stethoscope. And we're going to do that between each patient that we take care of today. Next we have our pulse oximeter. And then we have 3 types of thermometers, and we'll talk about each of these. And then last we have our blood pressure cuff. Alright, so I'm going to bring these around to the bed, and we're going to work on our client. Good morning, Mrs. Smith. How are you today?
Good morning. I'm well, thank you.
My name is Darlene. I'm a Jackson College nursing instructor, and I'm here to take some vital signs before the physician makes rounds. Are you in any pain this morning?
No.
No, none at all?
Nope.
Okay, all right. I need you to uncross your legs for me, please. Have you had anything to eat or drink in the last 30 minutes?
No.
Have you been up exercising or walking in the hall in the last 30 minutes?
Nope.
Nope? Okay, all right, very good. We want to check her activity level because that will change her vital signs, so we want them to be at rest for 30 minutes and then nothing to eat or drink 30 minutes beforehand because that may alter their temperature. The first thing that we're going to do is we're going to use our temporal thermometer, and every manufacturer is going to be a little different on how you use these, so I'm going to show you 2 different ways that the manufacturers suggest. So of course clean it first. And you want to make sure the patient's not diaphoretic. If they are, then just wipe their forehead off with a towel. But we push the button, and it has an infrared light, and we scan across the forehead until it stops beeping, and then we touch behind the ear. And then we get a reading, and then you can show your patient.
Thank you.
Okay? And then we just turn it off and clean again. Now this particular temporal thermometer, we just simply go across the forehead and then we're done. We don't touch behind the ear. Alright, so be sure that you're looking at the way that your manufacturer guidelines state. Another thermometer that we have, this is tympanic, so in the ear, and we have protective caps to put on the ends. And those are disposable for each patient. It turns on automatically. Now on an adult, remember you pull the pinna of the ear up and back because we want to aim the tympanic thermometer directly towards the eardrum. So carefully place it in and then get your reading. Alright, and we're all done with that. Now if a child, then you would take the pinna and pull down, straight, back, and down. Because again, you're straightening out the ear canal so that we can have the infrared light hit directly on the temporal membrane. Okay, and then we discard that. Another type of thermometer is an electronic thermometer. It comes with probes that cover it as well, again, and they're disposable. Now this can be used either oral or axillary. So once you get the probe cover on, you can put it under the tongue, and it takes about 3 to 5 minutes to get a reading. But I'm going to show you how to do it in the axilla because that's another spot where we would take a temperature. Apologize for saying a lot. We want it skin to skin contact. So Mrs. Smith, I'm going to take your temperature. We're going to place it, the tip of it, right in the middle of her armpit, and we have a reading already. Very good. Oh look, you're perfect.
I know.
All right, and then again, dispose. Now, if this were red on the end, that would be rectal, a rectal probe. So you have to know the difference between that. Lastly, we're going to take her blood pressure, and again, make sure your equipment is all clean before you use it on your patient. We want to make sure that her legs are not crossed. She's sitting in a comfortable position, and I'm going to support her arm. We could also put a pillow under her arm for support. Let me just show you how to do that. just in case you have a patient who's really weak, or maybe they have a lot of tubings. There. And we just want it at heart level, okay? Now the first thing that you're going to do with your patient is you're going to locate the brachial artery, which is on the inner aspect of the antecubital fossa. And you're going to press kind of firmly with 2 fingers because it's deep, it's an artery. And that's where you're going to place your stethoscope. So let's go ahead and put our blood pressure cuff on. Now I'm going to make this kind of snug, Mrs. Smith. This needs to cover 2/3 circumference of the arm snugly, both circumference and then height. So that is a good fit for her. We want to make sure it's not too big or too small because that's going to alter the reading as well. It needs to be about 1 inch above the antecubital fossa as well so that you have room to use your stethoscope. Okay, just relax your arm. All right, the first thing we're going to do again is palpate that brachial artery, and I'm going to inflate the blood pressure cuff. And when I feel that pulse go away, I'm going to make note of what number I get, because that's going to help me determine what her systolic blood pressure is going to be. Okay, so it went away at 140. So I'm going to release the pressure, allow her arm to rest, let the vessels refill, and then we'll go ahead and take the real blood pressure. Are you doing okay, Mrs. Smith?
Thank you.
Okay. Now with the stethoscope, you want to make sure that the ear are pointing forward toward your nose, not backwards. You won't be able to hear anything. And then once you put them in, just make sure, tap the diaphragm and make sure that you can hear okay. All right, so we're going to place that stethoscope right over the brachial artery where we felt that pulse. And when we start inflating this blood pressure cuff, we're going to go 30 milligrams of mercury above my number that I had, and that was 140. So I'm going to pump up to 170. Then we're going to release very slowly. We're going to listen for the first sound, and then we're going to listen until we don't hear any more sounds. Okay. Now some patients, their blood pressure is going to be very easy to hear. Some patients, they may be very difficult to hear, so it's okay to check it a couple of times if you need to, or if you need one of us to come and double check with you, we would be happy to do that. Again, be sure that you clean your equipment in between your patients. Inform your patient of what their blood pressure was, and then if you're concerned with the blood pressure at all, again, notify your instructor or the healthcare provider that you're working under. I'm going to go ahead and release this now. Then we would clean this again in between patients. Ask the client if she needs anything else before you leave the room. Make sure that she's in a low bed position, comfortable. All her needs are met. Let her know you'll be back in a certain time frame. Be sure you do hand hygiene, and you're all set with that. Thank you.